Welcome everyone to GSMA mHealth webinar. My name is Natalia and I'm managing mobile agriculture and mobile health programs at GSMA. I'm doing the introduction to this hopefully entertaining webinar, and then I'm going to hand over to two of my colleagues, which I'm going to introduce in a couple of minutes. So to give you an idea of what we're going to be covering today, we have an outline of this webinar, so you can decide for how long you want to stick around with us. Hopefully you'll stick all the way through and keep on asking the questions in the chat box available to you. So I'm going to give an introduction to mNutrition initiative, which has quite a complex name and actually refers to two different programs within GSMA. And then we're going to go through highlight lessons and results that we have learned over the last 5 years, which were very difficult but also rewarding, and we hope you will enjoy learning from us both around the mistakes but also about the things that actually work and make a difference. So over these 5 years, we were supporting projects in 8 different sub-Saharan African markets, and I need to say that implementation is not done by GSMA, but by business owners of mHealth services on the ground. And as GSMA, we have 2 different work streams that support this implementation, one of which is insights, and the second one is market engagement. So the 2 colleagues of mine, which are going to join us shortly and will drive this webinar content for you, are representing those 2 different work streams. So the 8 projects all have slightly different design, but what you need to know is that we have worked with partners in a range of organizational setup. What I mean by that is we work with mobile operators, value-added service providers, NGOs, health providers on the ground who might want to use digital tools. We involved the governments at the local level. We have created some public IP as a result of this that we would encourage you to use, which is digital content for all 8 markets covering maternal and child health as well as nutritional content. Please contact us for accessing this content. It's available in local languages and text and voice formats, and it would be really great to see this IP being used more broadly. So I would like to remind you that this work has been funded by the long-term partner of GSMA, DFID, that is covering multiple, supporting us on multiple programs within GSMA. And mNutrition initiative actually included 5-year work for both mobile agriculture and mobile health projects across both Asia and Africa. We published results on all of our implementation projects on both of these programs, and we would encourage you to look into the toolkits as well as case studies and global reports available. So this specific webinar, again, is focusing only on the health content, and the objective of the health program over the last 5 years was to reach over 1 million families across sub-Saharan Africa. This target was now overachieved, and we are counting 1.9 million families around sub-Saharan Africa who are using the nutrition, maternal and child health content through mobile phones. And we hope that this number will increase as the services gain traction and adoption. So these numbers have been driven to a large extent by a very successful project in Tanzania. We have a separate case study on that. But the webinar will focus on the lessons learned across all of these markets. So right now, I will introduce you to 2 of my colleagues. It's Kim and Moitze, who are coming into the studio and gonna talk about the lessons learned both from the business intelligence, monitoring evaluation, as well as the engagement side. How do you build the buy-in both from the government and the private sector stakeholders to achieve such tremendous scale and impact? Thank you, Kim and Mike. So we're looking forward to hearing from you today.
Thank you very much, Natalia. So as Natalia already mentioned, I will start with the project implementation and life cycle, starting with background to various stakeholders involving in this initiative. You will be able to see in the slide coming up soon, right now. On the left side, you can see all the local partners that we are working with. In the middle, you see a very small box of GSMA, who, regardless of the fact that it's only stated in one box, it was actually quite a complex setting. And then on the right side, you will see a list of organizations that contributed to the in-kind support. It is very important to note that mHealth team's approach was a bit different to some other programs. Namely, our program hasn't offered grants, but rather in-kind support to local partners that was offered in response to their commitment. So if you look, however, at the left side, you will see that the partnership structure worked across markets, with MNOs taking a stronger lead in some of the markets and value-added service providers or NGOs fulfilling this role in other markets.
So, Moita, I think before we get into more details, I think what you mentioned is quite interesting. So we didn't have the grant model, and we expected commitments from partners in order to work with them towards this. What were those commitments? Do you want to maybe elaborate on that?
Yeah, very interesting question, and I think that was actually one of the key lessons that we learned is the importance of the commitment itself. So there were four main areas that we discussed. One, on sharing relevant data on service usage. Secondly, on providing dedicated and relevant resources to support the mNutrition initiative. Thirdly, to marketing the service in collaboration with other partners. And fourthly, to C-level commitment to support the service and its evolution.
And obviously, in response to this commitment, we offered in-kind support as well as the GSMA mHealth team.
Yes, especially in the absence of grant funding, we endeavored via in-kind support that would be equally as valuable. For example, just looking at the mHealth team, we had a very strong market engagement management support. We had 4 different market engagement managers who were working each in 2 different markets. This enables strong local presence and successful partnership brokering, as also strong support to product management. Then we also had a content specialist. She not only contributed to the global consortium and management of a very complex setting over there, but actually more importantly, she contributed to the quality of the content development, as also to facilitate the user testing. Then on the side of market engagement, through the managers and on the content specialists, we had a really strong research insights team, which actually you were one of the major team members on it. So as part of the research insights team, we had business intelligence manager, we had a user experience specialist, and we had a knowledge manager who, as part of the service diagnostic process, provided together with global partners service design consultancy. So for example, just looking at these 3 roles, business intelligence manager was providing regular analytics of user log data and was managing also the M&E research. UX specialist was responsible for managing and more importantly for supporting global and local UK consultants and also product development. And then lastly, knowledge manager was responsible for knowledge dissemination through either internal or external events. And also, very importantly, supporting working groups where, together with our key local partners, we are building capacity.
So obviously on the right-hand side, we have all of essentially the global consultant network that we partnered with. Can you share a bit more on what each of them were responsible for?
Yeah, you can see Natalia already mentioned UK8, who is the funding organization. And then below that, you can see the Global Content Consortium, which was coordinated by CABI, but was working together with ILRI, GAIN, Oxfam, and British Medical Journal on the nutrition landscape in the content side in each of the country. Then they were also responsible on contracting the local content partners and on assuring the quality of the output. Secondly, very important organization that we brought on board a little bit later was Frog Design, who provided 2 different rounds of on-the-ground UX research. And they were also responsible for analysis and the development of recommendations for the product improvement. Then Altai Consulting helped us with monitoring, evaluation, and learning framework on the mNutrition initiative, according to which they actually then conducted feedback service and qualitative focus group across all 8 markets. They were both essential to demonstrating the impact of mHealth services, about which we will be talking later on. And then lastly, we had TNS, who supported us with the primary research, and they were actually working on trying to understand better the target users, and Palladium, who worked with us on the market access document and supported the market engagement team in the conversations with the government.
So having been engaged on this project now for the last couple of years, I think we all have our fair share of learnings around the complexities that come out of these sorts of networks of partners. Maybe if you want to give some of your key takeaways from this program, basically the things that you will make sure to do in another program that you're engaged on.
Yes, I think we could spend the entire day talking about the lessons on the implementation, but I kind of chose 3 different lessons, each of them referring to one of the pillars. So for example, if looking from the local partners perspective, I would once again mention that when you do not have grants in place, commitments are very crucial. Namely, especially in health space, service development can take quite a while, and from this perspective, you need to ensure that local partners are committed to working with you throughout the longer term. Then secondly, looking at the GSMA approach, I think it was very important and crucial that we have very strong market presence. So for example, each of the market managers were only responsible for 2 markets. That not only meant that they were more frequently on those markets, but that meant that they were able to actually build very good relationship with different stakeholders, everything from the service provider to the government as also mobile operators. And then more importantly, that they were the ones actually contributing to the product development. And then thirdly, looking at the very complex side of the global consultant side, I think it's crucial to mention that while they were offering so many expertise on specific areas, the problem was that managing them throughout was quite challenging. And I think what you really need to ensure is that you're aligning these timelines so that they're supporting each other. So for example, just one small example is content and user experience has to be aligned. You do want to take in consideration that first batch of content is, for example, developed and then through user experience then tested.
Great. So I think now that we've mentioned the complex network of partners, perhaps you can talk a bit more about how we engaged across each of the markets in which we worked.
Yeah, so it's quite a packed slide in front of you, and maybe just a few seconds on what it's presenting. So you will see on the right side, you will see how number of users were, or the uptake of number of users. And then from the left side to the right is a timeline of our engagement. So completely on the left and bottom, you see due diligence and preparation, which was the start of our work. And I think it was essential that, especially when you're going into the new markets, you start by building a better understanding of who are the stakeholders that are in the market, what is happening in health sector, and also what is already existing mHealth. Namely, very important to add is that we did not want to add to the fragmentation of the market. We rather wanted to work with existing services and make them stronger, nationwide available, and commercially sustainable, hopefully at the very end. Then secondly was the primary research and market feasibility. So namely, as soon as we started understanding from the stakeholders' perspective of what is happening, what is government priorities, it's also very important to understand better the target market. So you need to understand your users, and through the TNS research, that's how we built it. We also did market feasibility studies that helped us with conversations with the government. And through that, we kind of start engaging conversations which are crucial in mHealth space. Then, when we had that in place, we started much more active partnership brokering and government engagement. And following that, we started with the content development. Content development was quite a long process. It included quite a lot of different activities, everything again from understanding the landscape to putting together different fact sheets, to start creating content which we have created in different batches, looking at different target groups. We, at the very end, then also still validated with the government, which took additional time. Throughout all this process, we had market engagement and product development, which you see at the very top. And that was simultaneously running while we were actually also looking at other things. And this is where you see the crucial thing of alignment that needed to happen and could have happened in a little bit better way. I guess at the very far right side, you will see marketing. I think it was very important to add it in some of the countries. We also supported our key service providers with marketing. However, the service needed to be at a point that it was to be shared. Yes.
So Moitse, I think once again a couple of key lessons around the actual project life cycle and how we approached it. Some golden nuggets to share with those listening today.
Yeah, and I think I kind of like already, but through describing what was the project timeline and how we approached it, I think I already shared some of them. But again, I would again stress how important it is to conduct very robust due diligence and research, especially from a perspective you need to inform your strategy. You need to do the product development and timelines as it has. If you fail at the very beginning, you will fail in the phases later on, and you will need to go back to step number 1 and start again. So I would again like try to motivate everybody on the call who is looking into developing services to do it and do the proper planning at the very beginning. I guess secondly, given that we are working in health space, it is very important to engage with the governments. And knowing how complex it is to work with the governments, I would try to encourage everybody to do it early in the project. We need to establish the relationship early in order to enable better services, and then also to kind of like align with the government priorities and give like a timely input to the government when that is needed. Thirdly, looking from the product side, I guess I already mentioned before, but content development could have been closely aligned with the product development. While this is really easy to say, it's really hard to do because both of the streams require quite a lot of planning, timelines, and other stakeholders' involvement. And from that perspective, actually looking across all of these markets, it was quite challenging to achieve it. Yet, I would, again, from this perspective, encourage everyone to try and plan as well in advanced timelines as possible. Finally, on marketing, I also mentioned it briefly before, but I think it's very important that we conduct marketing only after the service is proven to be of satisfactory quality. I think there is a requirement of several rounds of product iteration just before the user experience meets agreed quality standards. And namely, only one should always keep in mind the negative effect on the credibility of the service that could happen with premature promotion of the service itself.
So I think, Moitse, to that point, I think it's important to mention, obviously, the fact that we have approached this through human-centered design principles and iterative product development. And obviously, we saw the results that it had on uptake and usage.
Yeah, and it's a bit ironic, but on purpose, that I haven't mentioned product iteration approach already previously. One of the reasons why I didn't is because of the spotlight that we have, but actually one of the key success factors was human-centric design together with business intelligence and M&E that helped us with development and improvement of the services. This actually contributed to utmost success, and what is even more important is that the success and uptake of the services that contributed then later on to the nutrition, behavior, and knowledge change. So looking, for example, at the slide itself, like at the very beginning of Q1 in 2016, you will be able to see that we had 16% of active users, and that increased to 36% of active users in Q4 2017. More importantly, I think, is the percentage of power users, and these are the users that share the service more than once. This has increased 5-fold. So up to now, I have shared with you program implementation and project timeline and lessons learned. There were only some lessons. You will be able to find by far more in the report itself. I would also encourage you to have a look at blogs where we shared quite a lot of other lessons learned on the content side as also on the user experience side. But I will actually now let Kim share with you lessons learned across the customer journey. I would also like to gently remind you that if you have any questions, please do send them to the moderator.
Great. Thanks, Moita. So I think just briefly on the service design side, within our resource page, or on our resource page, which we'll share the link of later on in the presentation, we have the mHealth Design Toolkit. And there are a lot more lessons within that toolkit around developing and optimizing these types of services for the end user and keeping the end user in mind. But having mentioned the end user, I think we can't talk about any of our service design approaches without mentioning the customer journey, which essentially formed the foundation of all the work we did on the product optimization and development side. The customer journey is what it says it is. It's basically as the customer engages with the product, and even before, what are all the steps that the customer has taken through in interacting with the mHealth service. So I'll briefly take you through each of these steps and also give reference to how our customers engage with our products. So the first is how users are made aware of these types of services. So that's your traditional marketing. And in our case, we had several different modes of marketing, but it could have been through mobile messaging, end of call top-ups, that sort of thing, or agent-driven promotion, and even mass media campaigns. So it varied across markets. Once users are made aware of the service, they then actually either sign up for it or register for it if that was required. And once they've signed up for it, they actually start navigating through the service, through USSD menus or IVR menus, depending on the design of the product. And obviously, after navigating through all these different menus, they actually access content. So in our case, the content, once again, was either SMSs being pushed to users once they'd subscribed, or it was actually voice recordings that they could listen to when dialing into an IVR system. And the idea was that as they engage with this content, they derive value and end up using the content on a repeat basis. And in some cases where it was relevant, where this was the case, there was actually a payment component as well. So users were required to pay either a subscription fee or a premium fee for using certain components of the service.
Kim, you mentioned as part of the customer journey, the awareness of the service, and I guess there are different approaches to it, everything from ATL to BTL, and I'll let you explain more about it, and also community healthcare workers and. Like, could you share with us, for example, what are the key lessons that we learned through looking at how to build better events?
Yeah, so I think obviously a lot of lessons there, but just 3 key takeaways that I'll share. One being that mass media campaigns are really effective at raising awareness of a service, so brand and so forth, but not very effective in actually educating users around how to engage, how to sign up, and actually what the value of the service is for them. In this case, we saw that community health workers as agents are much more effective in promoting these services. They're trusted individuals that already live in these communities, and so users are already quite comfortable with learning from them. And actually, when these 2 things, so mass media and community health worker promotion, are brought together in parallel, that's when we see it being really effective. So users now also have a point person they can go to if they ever get unsubscribed, unwillingly, or if they want to sign someone else up for these services, and so forth.
And maybe you mentioned community healthcare workers, for example, and you mentioned also them helping onboarding. But what about if that is too expensive, for example, it's not possible? How did service providers, or what were key lessons on the onboarding and navigation?
Well, I think on onboarding and navigation, basically the big lesson for us is that although we think SMS services and IVR and USSD services might be really simple for users to use, the reality is that it's not. So our target audience actually really struggled to navigate through USSD menus and IVR menus. And actually we have a great example in one of your markets that you might want to share.
So I've personally worked in Zambia quite a lot, and I had a chance to experience or work with users in just outside of Lusaka. And what we've seen is that with a service that we thought is very easy to use, the users were actually struggling quite strongly on selecting what is of their interest. So one of the things that we tried over there was gamification, and you will be able to see actually on the slide that is just up how we kind of like learn through an increasingly difficult task, or we kind of like taught users on using the keypad. And it was interesting that, like for example, we were taking users through a selection of A and B chances, or select 1 for this and 2 for that. And if there was an incorrect response, the system will explain back the error and will prompt the user back to go and try again. And then what we've seen is that at the very end, where the user managed to finish the game, is that their confidence in navigating through the actual service was by far easier or better than it was before. And I think what I also wanted to mention on the site is that the same service provider also looked at a mini IVR. So what we've seen over there is that they had a huge selection, and the users were kind of like struggling in selecting. And what they did is that for the new users, they gave them only 2 options. And then later on, when they became more comfortable users, they gave them additional options. And we've seen that that also helped the uptake of the service itself.
Yeah, so I think that actually relates to some of the main points, which is just shortened menus as far as possible, as few click-throughs as possible to get to actual content. You want users to derive value fairly early on in their experience, and as much hand-holding as you can do. So trying to help users journey through these services, even though we might find them quite simple. And then I think if I can quickly get to content, so once again, a lot of learnings from content, and Moitza mentioned that on our resource page we've bundled them in a blog series, which you're welcome to go and have a look at. I think, in short, the main content learnings were around language, so making sure that it's in a local language, that that terminology that you're using is intuitive, users actually do understand it. Testing these terms and messages with your users is highly important. And then I think the last thing was just that users really value dynamic, actionable, and personalized content. So we had a service in Kenya called Total Health, and basically they personalize the service by calling users by their name. When they send a message, they knew the name of their child and the gender, so it was really a personal service. It was also on demand. There was an SMS helpline that people could access. And here we saw just a phenomenal amount of value that users were deriving from that service and really enjoying interacting with the service. And then I think on the payment side, the big lesson for us really was that users don't really have disposable income, at least not amongst our target group, to pay for these types of services. When we did consumer research, we actually realized that there was very high willingness to pay for these services, but actually that willingness doesn't really translate into paying users. And if you are going to be charging users for these types of services, you really need to be effective in communicating the value proposition to the user upfront so that they know what they're paying. And then obviously be very clear with the billing model. Like, the last thing you want to be seen as is someone who's stealing money from a user because they don't understand when they're going to be charged and why. So make sure that these things are all very clear, and so that the user experience is optimal on that front as well.
Thank you, Kim. I guess you mentioned before quite strongly the service optimization and the importance of service optimization is one, also to deliver the quality of the service to the end users, and then in so doing, actually through this drive and improve nutrition knowledge and behavior change. Could you share with us approach taken to measure these results for nutrition outcomes?
Sure. So I think before I get into the approach, maybe just to explain a bit about our behavior change pathway. So obviously the idea was that we were bridging a gap in actual nutrition information, access to information, so that as users got more access to information and were reading these messages or listening to the recordings, they could acquire knowledge, they would comprehend it and retain it, and then overcome other barriers potentially to actually implement these appropriate behaviors in their households. So, and that's the ultimate result, is behavior change at the household level. The way we tested it was actually to conduct surveys with both user groups and non-users across each market. And we did sort of a test-like survey where we asked several questions around very specific nutrition topics, like breastfeeding questions or appropriate practices around vitamin and mineral supplementation. And then we observed answers to those questions. So they either had to get, there was basically only one answer. If they got it right, it was positive knowledge retention. If they got it wrong, it was negative. And behaviours we tested in a very similar fashion. So we asked questions like, what are infants under the age of 6 months fed in your household? And in exactly the same way, if they gave any answer other than breast milk, it was negative behaviour change. So if they said pup or water, anything to that effect, it would be essentially negative behaviour change.
And what were some of the results, for example?
So I think the biggest thing for us that we were quite pleased to see was that actually mobile is playing a role in bridging that access gap. So 1 in 3 of our users reported to not have access to this nutrition information anywhere else, which is actually quite remarkable. And once again, demonstrating that mobile is reaching people who really are underserved. And then I think more importantly is that once people do get access to these types of content services, we were actually observing that knowledge levels were improved amongst our users. So more specifically, we looked, as I said, across supplementation and breastfeeding, and we saw that there was a 16 percentage point improvement in the knowledge levels amongst our users in comparison to non-users. And in the same way, there was an 11 percentage point improvement amongst knowledge levels for our users in comparison to non-users when it came to breastfeeding practices. And I think just some of the key things here was that we realized that mobile has the ability to improve knowledge amongst users even when existing knowledge around certain nutrition topics is already quite high. So, for example, in Uganda, our non-user group had a 90% knowledge level around the fact that breastfeeding should be initiated within 1 hour of birth. And our user group, however, demonstrated a 7 percentage point improvement on that. So 97% were able to correctly recall early initiation of breastfeeding practices. And then in a similar fashion, actually, mobile was able to drive a much greater impact with poorly understood nutrition concepts. So in Kenya, actually, vitamin and mineral supplementation knowledge was really, really low. So only 5% of non-users knew or could correctly recall appropriate supplementation practices, but a remarkable 41% of users could recall vitamin and mineral supplementation practices. So so I think that was quite impressive to see that that it had the ability to actually drive knowledge improvement.
You covered nutrition knowledge now. What about the behavior change?
Yeah, so I think on the behavior change side, we realized that behavior change was actually quite strongly aligned to knowledge levels. So where we saw increase in knowledge levels, we ultimately saw increase in behaviors. So 69% of our mHealth service users were actually implementing the appropriate nutrition practices in their homes, which was a 13% improvement on non-users. And there were a couple of key learnings around how to drive behavior change in a more meaningful way. One of the things was that repetition of messages is not actually seen as a hindrance amongst our users. They don't mind getting more messages on the same topic. And actually it reinforced adherence to the behavior. So in Uganda, providing 4 messages on exclusive breastfeeding, as opposed to just 2 over a 4-week period, increased adherence to this practice by 8 percentage points. And then in a similar way, reminder notifications are really valued by end users. In Tanzania, 78% of those who recalled receiving reminder messages actually reported to go to the clinic in response to receiving these messages. And then I think what might seem quite logical is that behaviors are influenced over time. It does take time to change behaviors, but something as short as 2 additional months on a service resulted in an 8% increase in appropriate behaviors in Ghana. And then I think my last point is just that we really did see how product optimization drove improved health outcomes. So in Malawi, we did a baseline survey followed by 2 iterations of the product and several sort of really intense product tweaks and changes. And this actually improved adherence to appropriate nutrition practices from 49% to 70% amongst our users. So once again, a strong reminder of the benefit of actually continuing to improve these services for the end user.
You mentioned throughout the presentation stories and conversations with end users. Would you be able to share some with us?
Yeah, so I think this is always the challenge when you're sharing on like 4 years of this type of work. You have some phenomenal quotes from users of the value that these services bring them. And we have quite a few of where people have been influenced in a positive way to change behaviours in their home. We do have this one user from Kenya who shared on how he was actually really wanting to feed his child porridge, and obviously the child was under 6 months of age, but after receiving messages from Toto Health on exclusive breastfeeding, he actually decided not to do this. And he's quite proud of the fact that Toto has made him change, obviously for the benefit of the baby and the mother. And then I think what came as a surprise to us, although maybe it makes sense when you consider that these people don't have this information anywhere else, is just the fact that people felt really supported by these services, and beyond just educating them, the services are really a source of emotional support. We have this phenomenal quote, which is really my favorite, I think, where a mother was just explaining how even when you're fed up and tired, the messages encourage you and they make you feel special, and even your own husband may not tell you that. And so no guesses why that's my favorite, but I really love that that people felt that mobile health services were a private source of companionship and really someone who was journeying with them through this daunting thing called pregnancy and motherhood and fatherhood even. So yeah, that was a really great insight. And then I think, the most important thing for me is obviously, are people sharing information? Because if you're delivering a service that really adds value, people should be sharing this information with other people and referring these services. And we did see that. So across all of our markets, 43% of our users are sharing information. And for the markets that we have quantitative evidence to back sharing rates, we observed that they're sharing with at least 4 other people, which means obviously that the extended reach of our program goes far beyond the 1.5 million to actually 4.29 million people reached with this mobile information. And I think just on sharing behaviours, so users tend to listen together. So on the IVR systems, they would call in, they would sit in a group and actually listen to the messages. On repeat listens, we realized that people were calling again to share with their wife or their husband in some cases. And actually in other cases, we saw people write down. So we had one guy in Ghana who wrote down every message he received in a book, and he would take this book to his sister on a weekly basis and share the messages with her. So you could see that, the fact that people don't always have mobile phones is not an inhibitor to having this information actually get to the people that need it most. And I think, Moitza, now, obviously for us it's been a key focus that we want these services to always be providing this sort of value to these end users. And the big thing that we've been working on in our program is the sustainability factor. How do we ensure that these services will be offered indefinitely for these users?
Yeah, and I think it was one of the big parts of our program because as part of the M4D, we are trying to deliver social impact, but then on the other hand, we also want to deliver commercial sustainability. Maybe first thing, it would be good to define what sustainability for us is. We define it as covering operational costs and demonstrating enough benefits in direct and indirect way for the service owners to ensure continued service delivery. I guess for mHealth services, to find a source of revenue is an ongoing challenge, and the majority of the service providers still rely on donor funding. And given that typically donors fund mHealth initiative only for a set period, this leaves services vulnerable for once funding ends. So from that perspective, we looked at different business models. One of the business models that we looked at the very beginning and that a lot of organizations is looking at is business to consumer revenue stream. So although the majority of the target market have low, or because the majority of the target market have low disposable income to pay for healthcare services, this not necessarily could actually cover the operational benefits. And from that perspective, it is very important to actually also look at other models. Maybe just before we move to B2B and B2G, one of the comments that I would like to add is that in some of the markets we are seeing success. However, in African markets where scale is not necessarily as big, and for that perspective, low margins that cannot contribute to it, it's by far more challenging. So for example, Viamo is looking into it, especially from the freemium perspective. However, they're overcoming through quite a lot of challenges, and we are yet to see a true success. Then we are also looking at B2B and B2G. I think especially when we manage to create scale, large-scale mHealth services can be leveraged by governments and other businesses in emerging, and it's emerging opportunities for the revenue streams. Namely, services which are free to end users achieve market scale but far faster. And then when we have large user base, it generates a substantial amount of data, and it provides access to a large audience that can be of value either to the government, international agencies, advertisers, and it's also opening the door to the new revenue streams. One of the things that we also would like to mention is, instead of relying on a single source of income, we would like to propose or encourage for generating multiple sources of revenue. And we are seeing a very successful example in Malawi by, again, an organization called Viamo, where they're looking at various streams of revenue that are coming in. And we would like to encourage also everyone else to try and look into it. Another example would be Living Goods Uganda, where, for example, they are using mobile to improve health services and information delivery by offering a digital channel for frontline health workers. So, for example, support apps embedded on their smartphones can add additional mobile channel targeting and customers through a free SMS information service.
And obviously also improving efficiencies and work performance in the actual community health worker model.
And thank you, Kim, for helping me out. But yes, essentially the health services are providing subsidized digital solution, and through that optimizing the core business and reducing costs.
So obviously we've been engaging with mobile operators, and the big thing is, where do mobile operators generate value from engaging with these services?
Yeah, so I think very important is that not always they're looking at direct benefits, but sometimes they're also looking at indirect benefits, and especially from the improved customer loyalty. We had a nice example happening in Malawi, where we literally showcased how the service itself is contributing to the loyalty of the service, and how customers are sticking more to the service itself.
Moitza, so actually we've been engaging on behavior change services directed at the consumer, but this is just the tip of the iceberg. Where is the role that mobile and other ICT technologies can play in digitizing the healthcare?
Yeah, so look, if you're looking at the slide, you will be able to see at the very bottom capturing what are the opportunities in B2C or business to consumer side. And then everything on top of that, everything from healthcare professionals to healthcare centers and healthcare systems, is as part of B2G and B2B. And I would like to add that while up to now we were focusing very strongly on B2C, going forward we would like to look more into B2G and B2B. Given that we are slowly running out of time, I would like to invite everybody to have a look at our report. But just before we close, I would also like to mention 3 main recommendations which we think are key to the future of mHealth services. So first of them is especially on the greater government investment. We think that there is a huge need for government to get more involved, not just involved, but also to invest. However, for that, we need to demonstrate the value of digital solutions. What we're seeing is that, one, we either need to organize evidence that is already present and better communicate it to the government, or secondly, we also need to actually create new evidence for it. And then secondly is on ecosystem collaboration. We have been working on ecosystem collaboration for years. We've been talking about PPPs. However, I think we need to address current fragmentation even more, and we need to create a holistic digital health model. We need to stop using use cases. We need to look across and see in what way we can reuse what was already developed. And lastly, Again, on the industry collaboration, we need to address current interoperability issues, and we need to drive healthcare data integration. We need to start talking more about standards. We need to start talking more about privacy and security of data.
Great, thanks. So we're going to head over to the Q&A session now. We've obviously received quite a few questions from the audience already. If you'll just allow us a couple of seconds to just have a look through these questions and actually respond. If you have more questions, feel free to drop them directly to the moderator. Right, Kate, so I don't know, do you want to quickly start with the first question that we received there?
Yeah, so here's a question for Kim. You mentioned that in addition to the knowledge gap, there are other barriers to behavior change. Can you share any of the ones you observed?
Okay, so I think here there were quite a few, some of the more notable ones that I'd like to share now that we saw across all of the markets actually are things like cost and availability of nutritious foods. Obviously, we know that that is a barrier that mobile isn't going to be able to change. Food is going to cost what it is, and availability is going to be what it is. But what we can try and do is encourage consumption of local available foods, alternative sources of iron and so forth, cheaper sources of iron, and try and influence behaviors in that way. So that's one of the thoughts. The second is around actually, so women are very responsible for the actual cooking and so forth and making decisions around nutrition, but men are in the budget. They basically operate the purse strings, and so without their buy-in, it's really hard for women to actually change how they eat in the home. And once again, I think this will be something that most people who've been playing in the behavior change space will know, specifically in sub-Saharan Africa, is that it's really important to think of the gatekeepers and how you can influence them. So in this case, the men. And then, yeah, we mentioned it earlier, I think behaviors are really hard to change. There are a lot of really inherent cultural practices that are hard to try and curb. So this takes place over time. It takes time to change these sort of cultural and social norms. And then I think around breastfeeding, actually, there was an interesting one around social pressures. So sometimes there are very poor perceptions of women who breastfeed, which was quite a surprise in these sorts of settings. And yeah, just in general, you know, men having perceptions of women when they breastfeed. So trying to also support women beyond this and basically empowering them and helping them understand the benefit of breastfeeding so that they push through all of these really challenging experiences.
Here's a question for Moitza. Can you share a bit more on the content development process and how people can access the content?
Yeah, from content development process, we mentioned a little bit already before, but maybe looking backwards, it went all the way from trying to build a very thorough understanding of the landscape and what is the requirement for the content and what are the key priority areas of Ministry of Health. And through that, we started developing, or local content providers started working together with global consortium on fact sheets, which contributed then finally to mobile messages, which were developed in, depending on the countries, but mostly in SMS form and voice recording scripts form. And then where it's available, as Natalia mentioned at the very beginning, please do let us know if you're interested in the content, and we will share it with you. It's available for all 8 countries. I believe it's available in over 21 local languages. For all 8 countries, we have content available in English, so that you can actually understand, even in the countries where English is not one of the formal languages. So like that, in Mozambique, we have it in Portuguese and in 3 local languages. In other countries, depending country per country, it's also in what form and what kind of local languages. But the most important to add is that content in all of the countries was validated and approved by the government, and from that perspective, we find the significant value of it, and we would encourage everybody to let us know if of interest.
Here's another one for Kim. What is the gender breakdown in users, and was there a difference in behavior and knowledge change between men and women?
So, okay, so just to be clear, it's the gender breakdown, and then if there was actual difference between male and female in terms of knowledge and behaviors. So very briefly, gender breakdown, we had 60% female user base across all 8 markets, I think our goal was actually 65. So in the markets where we saw slightly lower female user base, we were quite encouraged. So for example, Malawi, we had a lot of male users who reported to be sharing. So we know that phone ownership typically sat with the male, but that sharing rates were remarkably high in Malawi, and a lot of cases of men and women actually reading and listening to messages together. Regarding the second part of the question, so whether there's a difference in actual knowledge and behavior levels between the 2 groups, this was the case in some markets and in others not so much. It also varied depending on their socioeconomic background, so whether or not they were educated or hadn't gone to tertiary education. So we had quite a few different ways of segmenting our users, and the difference in knowledge levels and behavior levels were quite different for each of those. And then again, in other markets, it was exactly the same. So if there's interest to learn a bit more about these differences and possible nuances behind them, please do get in touch with us. I think it's a bit much to go into every market and tell you exactly what all the different levels were. Kate, I think there's another question that's sort of linked to that.
Did you make attempt to change household gender norms?
Household gender norms. So I think my comment earlier on the fact that it's important to know who the gatekeepers are. So when we understood in our markets that men were obviously really important influences in the households, and even mother-in-laws and mothers and supporters of these women are really important to influence as well. In one of our markets, for example, in Tanzania, they actually have a way in which users can subscribe to receive very specific content to different groups. So if you're a supporter, you get very specific content that's tailored to you. And the idea here is that you actually communicate certain practices in different ways by demonstrating the value to different types of people. So you might communicate the benefits of breastfeeding quite differently to a husband than you would to a mother. And I think it really weighs very heavily on the content development side of these types of products. But really, these are the kinds of considerations you need to have when you're developing the content, and you need to continuously test the actual influence these messages have. I think actually that's all we have time for today. Before we end the webinar, I would like to just quickly share on some of the resources that we have in case you're interested in learning more. Obviously, a lot of what we shared on today comes from our report called Creating Mobile Health Solutions for Behavior Change. On the resource link that I'm sharing in the slide, you can actually access the report and then also an infographic which has sort of all the high-level insights from the program. Also on this resource page is 2 case studies. So one is on living goods in Uganda, which is one of our partner services, and then the service that I mentioned now in Tanzania, we have quite an extensive case study on healthy pregnancy, healthy baby as well. I mentioned the mHealth Design Toolkit earlier with 10 principles to launch, develop and scale mobile health services in emerging markets. And then we've also bundled our content learnings all into one place for you to benefit from, developing high quality mobile content. And then lastly, we've mentioned it a few times now, but a lot of the work that we're going to be doing going forward is embedded in this report, which is scaling digital health in developing markets. So I really would encourage you to go and have a look at some of those. And then I want to thank you for attending the webinar, and obviously a lot of you have been working with us quite extensively over the last couple of years, and we want to thank you for that too. And please share and share wide. We're going to post the recording of this webinar on the website, so we'll be sure to update you when that's available online. And if you do have any other questions, contact us on mobilehealth@gsma.com. Thank you very much for your time.